Hi, I'm Garrett Ball from MedicareWallet.com. Today we're going to talk about comparing Medicare Part D plans, also known as prescription drug plans, using Medicare's website, which is medicare.gov, medicare.gov. We're going to go through step by step on how you would do this on your own, very easy to do, as well as explaining why you should do this. Now, first of all, Medicare's website does have premium and copay information for all the prescription drug plans that are offered in each different zip code. So what we're going to do is go through step by step on how you would compare the prescription drug plans on Medicare's website. First of all, you're going to go to medicare.gov. You see I'm already there. You're going to open up the main homepage for Medicare's website. Make sure that you're on this particular site. It looks like this. There's lots of other sites out there, but this is Medicare's website, which has all the information that you need to compare the prescription drug plans. Okay, the first step, we're going to go to this green button on the left side here. It says Find Health and Drug Plans. Going to click that button. That's going to take us to step one. Okay, step one is where you enter your zip code. I'm just going to pick a random zip code. Looks like a Texas zip code there that I've run a comparison before. It's going to come up there, and if you're in a zip code that covers 2 counties, you're going to need to pick which county you live in. You're going to choose your county and click Continue. The next page that comes up is going to be step 1 of 4, where you enter some information. Now, you can select an answer to these and enter a lot more information about your current plans. To get just basic information without entering a lot of extra information, I would just recommend selecting I don't know what coverage I have and I don't know. You can enter more information if you'd like, but just to get the basic idea and the basic information, you can just select those choices. That will take you to step 2. This is where you enter the names of your medications. Okay, I'm going to just pick a couple of medications that are relatively common here. We've got atorvastatin, which is generic for Lipitor. You enter your medication, type it in there, then you'll see this little window come up where you select your dosage. Okay, so let's say you're on 20 milligrams of atorvastatin once a day, and you're going to click Add Drug and Dosage. Okay, give it just a second to load in there, and then you'll see it populates down on My Drug List. Next, let's do one more here. Let's do lisinopril, which is a common blood pressure medication. So we're going to do, let's say you're on 10 milligrams once a day of that. We're going to add drug and dosage, and that will populate as well. And then let's say you're only on those 2 medications, and you're going to click My Drug List is Complete, which is at the bottom of the drug list. You see right there, there's a little brown button. You're going to click that, and that should take you to the next step. There we go. Okay, so while that's coming up here, we're going to take a look at the next step, which is select your pharmacy. Most people have a pharmacy that they prefer to use, so you can select that pharmacy. It's based on your zip code, so you'll see all the ones that are within, within a certain mileage of your zip code that you've entered there. So if you don't see the one that you prefer to use, you can always go up here to increase the radius for the pharmacies. But let's say you use CVS. Okay, so we're going to click Add Pharmacy, and then you see your selected pharmacies there. If you want to compare multiple pharmacies, you can select, CVS and Walgreens, Rite Aid, Kroger, whichever ones you want to compare, and you'll see them all populate right there. So once you have your pharmacy, you'll click up here the brown button, Continue to Plan Results. Okay, so that's going to bring up the next step. Now today we're talking about comparing prescription drug plans, which are listed right here. So you scroll down a little bit, and you'll click the little checkbox there beside prescription drug plans, and it says there's 23 plans available in your in this zip code, this Texas zip code that we're using. Then we're going to click Continue to Plan Results. And that's going to bring up the results for the plans. Now, Medicare, you scroll down a little bit here, and Medicare will rank the plans based on which ones have the lowest annual cost. Now, you can select a different rank, a different way to sort the plans here. If you want to select, you can see you can sort them by premium, sort them by deductible, sort them by overall star rating, which is Medicare's rating methodology for Part D plans. What I'm going to do is I'm going to leave it at lowest annual cost. Now, the reason why I recommend comparing them based on that is because the prescription drug plans, they can vary a good bit in how they cover medication. So what Medicare does, it adds the premium, which on this first plan, that premium is $22.90. That's the monthly premium. There's no deductible on this particular plan. And then it adds in the copays for the remainder of this year. So it adds in the copays. So what I generally recommend is you can compare up to 3 at a time. So check the little check box there. You can compare, let's see, we're going to compare the top 3. Then you're going to go up to compare plans. And then that's going to pull up a little bit more detailed information. It says your plan comparison. Now keep in mind, this is based on the medications that we entered and the pharmacy that we entered. So the results, would be different if you're on different medications, or if you choose a different pharmacy, different plans may come up. So the copays vary considerably on the Medicare Part D plans. If you're on a lot of generic medications, you may have a plan come up that's a lower premium plan. If you're on brand name medications, it may be that you can spend more in premium in exchange for a much lower copay on the medication. So what I'm going to do is go down. This is comparing those top 3 plans. You can see what tier the different medications fall under. And then what I like to go to is print comparison report. Okay. So that's going to pull up a report, and it says customize. We're going to just look at all the information they have here, and go down to print. That's not going to print it. That's just going to pull up a format that you could print if you wanted to. That would be a easy to view format. So if you'll see here, you've got all 3 plans listed in columns. You got the first plan, SilverScript Choice, the second plan, Humana, the third plan, WellCare, and those 3 plans are here. Now, the numbers that you want to look at, fixed cost. If you'll see fixed cost is, first you'll see the medications, then you'll see fixed cost, and you'll see the monthly premium and the deductible. So you can compare kind of those fixed costs that you would have under each plan. And then the next thing that you'll see is what I would call the bottom line number. This number is Medicare's number that takes into account the premium times 12 if you're signing up at the beginning of the year, or however many months are left in the year, times the premium times 12 plus the deductible if there is one, and then the copays are added in as well. So this is kind of the bottom line number. So if you're comparing this plan, you're on these 2 medications, you're going to be on, you're signing up for a plan in January, and you want to look at the January enrollment. This is your bottom line cost. This is your premium plus your deductible plus your copays on each of these 3 plans for the whole year. Okay. Then if you want to go down a little further, you can see the full retail cost of the medications. Then you can see what you would pay while you're in the deductible, which would be in most cases the same as the retail cost if there is a deductible. And then next you'll see the initial coverage level. Now, what that is, the initial coverage level is basically Medicare's terminology for your copay. So this is what you would pay. You'd pay on this particular plan. You would pay $3 for atorvastatin and $1.30 for lisinopril. That would be your copays on a monthly basis. And those numbers, all of what you see starting right here is incorporated into these numbers, which is the table that's labeled estimate of what you will pay for drug plan premium and drug costs at CVS Pharmacy. So this, and then if you go a little further down, you can also see the month-by-month breakdown of what you would pay, taking into account the premium and the copays for each of these different plans. So this information will enable you to compare all the different plans and make an informed choice about your prescription drug coverage. I'm going to go back to this page here, and then if you want to go up here, you'll see a little button. If you're signing up for a drug plan, you can even enroll right through the Medicare website under each plan. So you can use that to enroll in the plan, or you can call the plan directly. There's a phone number here and a website for the different plans. You can call them directly, or you can do it straight through Medicare. Now, it's important to compare the prescription drug plans annually, and the reason why is because they all change every year. They change. So the annual enrollment period for Part D is October 15th through December 7th of each calendar year. So it's important to compare them. If you don't have an agent or don't have somebody that you're working with, you can very easily do it on your own using this video and these instructions. So it's easy to do, and it's important to do. So I mean, I've seen people save as much as $2,000 a year because they were in the wrong drug plan for their medications. So that concludes our video today. Thank you for joining us, and I'm Garrett Ball from MedicareWallet.com. See you next time.